Hey everybody, and welcome back to the Complete Dentures 1 course at New York City College of Technology, Department of Restorative Dentistry. This is Module 11. This lecture is the last lecture within the set, so I want to thank you for joining me throughout this journey this semester, and I hope to see you in Dentures 2 next semester. Today we're going to talk about one of my favorite things, wax characterization, also known as festooning. Let's begin. To start off, I want to cover the term festooning. Festooning, in reference to dentures, just means to add wax characterization to make the tissue or wax look like tissue. The concept or definition of to festoon is actually to put ribbons on, or something that's adorned with ribbons or garlands or things of that nature. So from my perspective, I don't see that as being a proper definition of what we are trying to accomplish here, right? I think we need to remember that we are making oral prosthetics, and the goal of the prosthetic is to simulate nature as much as possible. So what we are doing, we are characterizing the wax to look like gum tissue. The concept of festooning kind of minimalizes what that actually means. And I think that the concept of making an oral prosthetic needs to be translated to, what if I was missing a nose, an ear, an eye as a patient? Would I be looking for something that is not textured or created to mimic the nature that surrounds the prosthetic? With that in mind, I do think that the industry needs to put a step forward in not making these shiny, pink smoothie dentures, as some of my colleagues and I like to call them. The goal is to create texture to make the prosthetic look as natural as possible. And that's done through our wax characterization process. So to begin the lecture, let's talk about the wax trial dentures. At this point, we have a tooth setup that is complete set of dentures, maxillary and mandibular. On the image to the right, you'll see that there is a clasp on that last stone tooth. That is because this is technically a partial denture that is held in with retention from a clasped molar back there, one of the last teeth in the mouth. But still, nonetheless, full amount of teeth. I would still call this basically almost a complete set of dentures here. So a wax up is formed around a completed tooth arrangement. The pattern is a simulation of soft tissues attached to the teeth, alveolar processes, and palate. The combination of teeth and wax up on a record base is called a trial denture because the dentist tests its appearance and function in the patient's mouth. The trial denture then becomes a pattern for form molding. Denture-based plastic is converted from a dough into a solid. Based on the series of events, there are two places in a complete denture procedure where soft tissue contours must be simulated in wax. That's the wax up for the try-in and the wax up for the final. So there are two different situations where there is a wax up denture being created. And initially, right now, where we are in the semester, we are creating a wax up for try-in, right? We arranged our teeth, our tooth setup is complete. Now we're going to wax up our case to be sent to the office, and in the office the clinician will try in this wax trial denture in the mouth, and the patient will look at it, they'll evaluate, and then they will get sent back to us for us to perform our final wax up right before we process the wax denture into a solid final acrylic denture. So the dentist usually requests a try-in after the denture teeth are set in occlusion on the record base. The wax up is usually not characterized because the dentist often makes changes to this trial denture. The evaluation of the wax trial denture in the patient's mouth permits the dentist to establish the final tooth position. After the try-in and before wax denture investing procedures, a detailed final wax up is done. Now, within that sentence, I would like to put in my 2 cents. The concept of not actually performing a detailed wax up or characterized wax up, as it says in the second sentence there, is to me inaccurate. The way that the wax denture looks should exactly replicate in the final processing of the denture. So for example, if I did not put all of the texture and detailed anatomy into this wax up for try-in, then at the try-in, the patient is assuming that they are getting a smooth piece of shiny wax or shiny smooth surface denture. The concept is that what if the festooning you perform at your bench and then process is not liked by the patient because this is not what they saw during their try-in, right? The goal of the wax try-in is for the patient to evaluate what is this going to look like in the final stage. It is not just about tooth arrangement. It is also about tissue contours, because tissue contours also translate into border thickness and how much lip support there is. So without waxing this denture properly during the try-in phase, it can actually affect how the denture fits ultimately in the final insertion phase once it's processed into acrylic. So wax characterization for me is a huge part of the try-in, and the fact that the Air Force says that it should not be or usually is not characterized is false, and I believe that it should be. Waxing and contouring procedures reproduce the appearance of natural gingival tissues as closely as possible. The external surfaces of the denture bases are shaped to promote cleanliness and denture retention. Once again, as it says in that last sentence, the external surfaces of the denture bases are shaped in order to promote cleanliness and denture retention. If these borders and outside surfaces or external surfaces are not contoured correctly during the wax phase, it may serve as a complete different feel for the patient during the final insertion phase. So it is important, wax characterization in the try-in phase. So then we have bulk waxing. So because the record base probably won't have enough wax covering the facial or lingual areas due to an inadequate contouring job, more wax has to be added. As you see in the image to the left, after you set your teeth, more than likely that you have necks of your denture teeth showing or not enough wax covering the denture base, which serves for a messy, dirty looking wax denture. So wax does need to be added, and we call this procedure bulk waxing. The easiest and fastest way to add a lot of wax is to use an eyedropper or an electric wax heater. To prevent the wax from freezing in the dropper, warm the glass in a Bunsen burner flame. Use the dropper to carry the wax to spread it onto the trial denture surfaces. A large wax spatula can be used, but the procedure must be a little more time consuming with a spatula. Procedural steps are listed individually for maxillary and mandibular trial dentures. First, fill all the interproximal areas with wax. Ensure wax is not added to the facial or lingual sections at the same time. When applying bulk wax, allow wax time to sufficiently cool on the facial surface before adding wax to the lingual surface. This will avoid tooth movement. It is important to understand that when you're waxing and bulk waxing, the wax is getting hot. The wax is what's holding these teeth in the proper position. Once the wax gets too hot, the teeth can then move without you noticing. A lot of the times you might festoon or wax characterize or bulk wax a case off the articulator. You'll completely finish the case, put it back onto the articulator, and see that your teeth no longer are in contact the way they were before. So bulk waxing and wax characterization is a good way to get a good aesthetic result. However, you still have to be conscious of the function of the teeth. You don't want to move those teeth while you're performing your wax characterization. So on the facial surface of the wax over the collars of the teeth should be about 1.5 to 2 millimeters thick and extend from just above the collars down to the sulcus of the cast. If the border of the flange does not fill a sulcus, correct the discrepancy by adding wax. On the lingual surface, the wax layer starts occlusal or incisal to the denture tooth finish lines and proceeds about 10 millimeters towards the palatal vault. Wax near the finish line should be about 1.5 to 2 millimeters thick. The lingual wax is blended into the palatal area of the record base to make a smooth transition. Now, there are two versions of this bulk waxing. All over the teeth aesthetically, where you see in the image where wax needs to be added, that type of bulk waxing needs to be performed before the wax trial denture can be finalized. However, there's also bulk waxing that occurs during your final wax up as well, but we'll cover more of that kind of bulk waxing for final processing in next semester. Here are some shots of what bulk waxing may look like. All right, so initially in the three images from right to left, you'll see that you have a very standard amount of wax around the teeth, just holding the teeth in position. Next picture is a layer of different colored wax, and then the next picture is another layer on top, which is more closely related to the image we're looking for and layering of wax for colorization of wax. So not only do we talk about the wax characterization from a texture standpoint or aesthetic look, but we're also talking about color depth. We want it to almost look like there's blood flow underneath the layers of tissue, right? And we can achieve that by using different colored wax in layers. Now, this is not 100% necessary. This is on the higher end of denture work. If you are making an economy denture, then you would just be using one solid wax, as you see in the lower images of solid wax and a simple carve. Here's an image to go with what we had spoken about before, the 1.5 to 2 millimeters thick around the collars of the teeth there, the necks of the teeth, and then the 10 millimeter palatal vault area ascending down. Once we have our wax bulk trimmed and everything is ready, then it becomes time for our gingival trimming. So in this procedure, the objective is to simulate the appearance of natural tissue near the necks of the denture teeth without creating food traps. In keeping with this objective, the interdental papilla must always extend to the area of tooth contact and fill the gingival embrasure, and the papilla must be convex in all directions. The following steps apply to both the upper and lower arches. Please note, keep the point of the carver against the denture tooth surface while you're performing this procedure. Another thing I'd like to mention is that gingival margins and carving the gingival trimming is one of the most key points to having this case look aesthetic. Clean gingival margins attribute to a natural looking denture. With wax over the teeth, it gives the illusion of false teeth. Facial gingival trim. Hold the carver at 45 degrees to the horizontal. In one or two continuous curving motions, remove the wax down to the junction between the crown and the collar of the denture tooth. Perform the procedure around each tooth. On the lingual, hold the carver horizontally. Trim around the lingual surfaces of the denture teeth at a level slightly occlusal or incisal to the denture tooth finish lines, about 0.5 to 1 millimeters. Do not remove wax from under the finish lines. The goal here is that you have a distinct, definitive finish line between the wax and the denture tooth on the facial and lingual surfaces. Continuing gingival trimming. The regularity of the gingival trim should be broken up by varying the height and the shape of the scallops and interdental papilla areas, as we see in the image above. You'll see that creating uniform gingival margins will create a false look. Each tooth has a different height, and so does the interdental papilla areas. The concept should be that if you think about how you floss your teeth, your interdental papilla sits directly underneath your interproximal contacts between each tooth. That papilla is mobile, allowing you to floss between it. Therefore, wax should not come into the interdental contact areas. Those interproximal areas between your teeth, the gingival tissue, the wax should not exceed into those areas. As the figure shows, it is typical for the maxillary canine gingival margin to be the highest in the quadrant, and for the first premolar margin to be only slightly lower. This relationship is frequently ignored. Many technicians incorrectly persist in producing a gross step between the heights of the canine and the first premolar gingival margins. Gingival contouring. The architecture of a person's gingiva changes with age. On young people, you can use a half-circle gingival trim. With middle-aged people, use a half-circle or half-oval gingival trim on different teeth. In elderly persons, you can produce a combination of half-oval or blunted V gingival trims. Expose a little of the collar on a couple of teeth to imitate recession of the gingival margins. This is always good for patients that are a little older. Having perfect tissue and a perfect set of arranged teeth really gives the illusion of false teeth once again. The older a patient gets, the more teeth have moved, the more blunted the gingival anatomy is, the duller it may be. So the idea of having a setup with more characterization to the tooth setup, meaning maybe one lateral slightly longer than the other, maybe twisted, things of that nature, along with the gingival trimming, can really make a oral prosthetic disappear in the mouth, especially when it comes to complete dentures. Because interdental papilla also recede as people get older, it's good to simulate this characterization in the denture work as well. However, do not use this as a license to indiscriminately dig wax out of the interproximal areas. The more pressing obligation is to avoid creating food traps. So while you're also carving and wanting the case to look as natural as possible, it's important to also remember that this is an oral prosthetic that has to function and be easily maintained. If there are too many pits and areas where food can get trapped, then it defeats the purpose. Okay, so it has to be a harmonization between function and aesthetics. Producing root eminences and flanges, the same rules apply that were presented with the basic wax up. Do not produce deep, straight, parallel slots between your root eminences. All eminences and concavities must blend into one another. Flange surfaces are mostly concave to aid in denture retention. So in speaking about root eminences, to simulate root eminence and attached gingiva in the mouth, the attached gingiva is directly bound to the bone and is relatively immobile. It extends from the free gingiva towards the sulcus for a variable distance of about 3 to 8 millimeters. The band of attached gingiva is widest in the anterior regions and narrows posteriorly. The root eminences are most visible in the attached gingival areas. To simulate the soft tissue contours of the alveolar mucosa, the alveolar mucosa is loosely bound to the bone. The alveolar mucosa begins where the attached gingiva ends and then extends into the depth of the sulcus. To shape the lingual and buccal surfaces of the denture base in a way that promotes denture retention, when gingival trimming procedures are performed, a pointed instrument has to be used to make sharp, clean cuts. In contrast, contouring wax requires forming convexities and concavities that blend in with one another. To achieve these effects, round-ended instruments best work. The large end of the Woodson instrument or a number 7 spatula should produce the desired results. For anterior root eminences, in the anterior area, the maxillary canine eminence is the longest and the most prominent. The lateral incisor has the shortest eminence, and the central incisor eminence has an intermediate length compared to the eminence of the canine and the lateral. Follow the same concepts for the mandibular denture as well in the anterior region. When it comes to posterior root eminences, whereas anterior root eminences are relatively prominent, posterior root eminences are less prominent and generally shorter. Premolar eminences are slightly longer than molar eminences. When creating the illusion of a root eminence, ensure the concave areas between the roots blend smoothly into the convex eminence areas. Produce eminences and concavities that are round and irregular in height. Avoid parallel V-shaped concavities that look like ditches aligned with a ruler. The goal is to have smooth surfaces. One thing to remember is that there are no straight lines in the oral cavity, right? Everything is curved and, for the most part, smooth, minus a little bit of texture from the tissue. So what we're looking for here is not harsh lines or harsh individuality between your root eminences, but more of a smooth blend between all of them, as seen in the photos above. Next up, as I just discussed, the texture of the wax is important, and this can be done through stippling. To accomplish stippling, the stippling effects make a denture base appear more natural by breaking up the continuity of large reflective surfaces. The result is much more pleasing than a glossy, shiny look. Using these techniques, there should be no stippling within 1 millimeter of the gingival margins and 3 millimeters of the peripheral borders. Reason being is that in the mouth, believe it or not, that gingival margin is actually quite smooth. Having smooth peripheral borders as well aids in that food does not get trapped in those areas. While working with the wax up, stippling may be accomplished by one of the following methods: a positive technique and a negative technique. Positive considered to be blowing on wax technique. Place paper tape on the facial surfaces of the teeth so that they do not get splattered with wax. You want to pick up molten wax with an appropriate instrument, maybe a number 7 or more likely a number 31 spatula. Blow off the instrument onto the denture's facial surfaces to impart a bumpy effect, as you see in the image below. Lightly flame the denture following the application of the blow-on stippling to remove sharp corners from the stippled area. Stippling should be most evident in areas that replicate attached gingiva and concave portions of the denture base. And then you have a negative brush technique. You may stab the denture brush repeatedly into the wax denture where stippling is desired, leaving tiny little holes and flecks of wax on the high and low contours of the wax denture. Carefully pass a low brush flame over the roughened areas. You could do this with an alcohol torch. The objective is to cause the wax flecks to disappear, the high contours to glaze somewhat, and the most prominent stippling to remain in the areas that replicate attached gingiva and concave portions of the denture base. So there's two different methods there. Sometimes I would say the positive adds a little bit too much texture if not done correctly. Most people, also from a time perspective, the brushing, the negative technique may suit better in production scenarios. Then we have our palatal and lingual contours. To create a uniform palatal thickness, the patient's speech is affected if the palatal vault of the denture is too thick. Make a vault area thick enough so that it is reasonably strong, but not so thick it causes speech impairment. Palatal and lingual surfaces of complete denture should be smoothed, unless there is a rugae, as pictured in the right, if it's requested by the patient. To note, most patients who are receiving dentures as a new set, right, if they're already wearing a set of dentures, chances are if the palate is smooth, then the new denture must be smooth as well. Very difficult for the tongue to get used to rough areas or textured areas when they're used to a smooth palate. Rough areas, I can compare it to if you ever had a filling. You notice that if your bite is a little high, it seems that your tongue keeps going to that space. So it can be irritable. However, in the event where a patient is getting a set of dentures for the first time, a rugae is something that is easily adaptable to. There are two methods of fabricating a rugae, which are prefabricated wax patterns or fabrication through a traditional wax method using a matrix. But we'll talk more about that next semester. Shaping the trial denture flanges. The labial flanges are made slightly concave to accommodate the natural drape of the orbicularis oris muscle, which is basically the muscle that's located within your lips. Those orbicularis oris muscles allow you to make the kissy face. Buccal flanges. These flanges are made concave to allow for the natural drape of the buccinator muscle. The buccal shelf area of the mandibular buccal flange is somewhat more concave than its counterpart flange in the upper denture. On the mandibular denture, the lingual flange, the flange has to be concave to allow for the tongue to fall within the borders. Lightly flaming the gingival trim and mucosal contouring, you can apply the flame to one surface at a time. Generalized heat can cause tooth movement, so be careful. Remember that interdental papilla must be convex in all directions. Blunt the crest slightly. Do not leave them needle sharp. Checking and correcting the occlusion is one of the last steps. Even though you've waxed the case and you've set the teeth properly prior, remember that after all the heat and molten wax that's been applied to your denture, chances are that some teeth may have moved. Always check this before sending out to any office or before processing. Touching up the wax. If the wax has been disturbed or any excess wax is on the teeth or flange borders, now is the time for touching the areas up. The trial dentures are now ready for the dentist to evaluate while they are in the patient's mouth. Here's a small diagram for those concavities we spoke about on the borders to allow for those muscles to rest in those areas, including the tongue. The final wax up. The assumption is at this point, the dentist has performed the try-in, made the adjustments, and returned the wax trial denture to the laboratory. This final wax up is something you're going to be doing next semester. I just wanted to allow you to see the difference. One of the main differences is that the denture ends up being completely waxed to the sulcus areas and prepared for processing. We'll get more into this concept next semester. Overall, I know that there was a lot of images and a lot of information within this PowerPoint. What I want to get across is that I do not expect the type of aesthetics that you've seen in these photos to appear in the first time you've ever set a denture. What I look for more is a clean aesthetic look. I want something that has no wax on the teeth, clean gingival margins, and overall good cleansable contours. As far as coloring wax, we do not focus on that within the first time you create a denture, and I'm not looking for very distinct or aggressive gingival anatomy. Something more along the lines of what you see here is something that would produce a very good quality denture. So before we have our teeth set and then our bulk waxing occurs, and you can see our after, same exact case, clean gingival margins, a very light general root eminence contouring, and the case looks clean, proper, and finished. Here's the facial view, and here's the lingual view. There is not a lot of wax all over the model. There is not a lot of wax all over the teeth. Once again, clean gingival margins, properly contoured root eminences, smooth and textured where it should be, stippling underneath the gingival margins and above the borders. And on the lingual, you can see clean gingival margins on the linguals of the teeth as well. For this week, your readings will be from pages 278 to 288 on wax trial dentures and festooning. This, once again, is the last lecture within the series, so I hope that this semester went as smooth as possible. I hope you learned a lot of pertinent information in regards to complete dentures, and this information has interested you enough to possibly take up the specialty of complete dentures in the future. Remember, next semester we have Dentures 2, where we will be processing these wax dentures into acrylic. We will be performing numerous amounts of repairs, fracture repair, tooth repair, and also a reline. So I hope you all looking forward to that, and I hope to see you healthy and well next semester. Once again, thank you for participating in the lecture, and look forward to seeing you soon. Bye-bye, everybody.